How worrying are the UK, South Africans, and Brazil coronavirus variants? New variants of coronavirus are emergency that are more infectious than the original on when they start the pandemic. Scientists are urgently studying the mutated version to understand what they pose. What are the new variants? Expert concerns currently focus on a similar number of new variants of coronavirus. A UK variant that has become dominant in much of Britain and has spread to more than 50 other countries. A South African variant that has also been found in at least 20 other countries, including the UK. A variant from Brazil. How serious it is? It's suspects It suspects that the UK, South African, and Brazil variants could be much more contagious or easy to catch the earlier version. All they have undergone chance to their spike protein, that is the part of the virus which attacks to human cells. As a result, these variants seem to be better at infecting scales and spreading. Experts that the UK Afghan strain emergence in September and may be up to 70% more traceable on infection. Although less research by Public Health England, but is between 30% and 15%. It is this variant which has driven the last lockdown around the UK. The South African variant emerged in October, and it has more potentially important chance in the spike protein in the UK variants. It has one of the same mutation and the UK one, but to more that scientists think may influence more with vaccine effectiveness. One of they may help the virus affect part of an immune system called antibodies. The UK has imposed a ban of direct flight from South Africans and residents of flight to the country. Anyone who has traveled there recently and anyone they have been in contact with are being told to quarantine immediately. South Africa's coronavirus variants. What was the risk? The Brazil variant emerged in July and has started the mutation in the spike protein that make it similar to the South African ones. The UK government announced a ban of flights from South Americans and Portugal as a result of the development. Will vaccines still work? The current vaccines were designed around earlier variants, but scientists are confident that the should still work against the new ones, although perhaps not quite as well. The studies are underway to check this. Vaccine train the body to attack several parts of the virus, however, not just these sections of the spike protein. Variants could emerge in the future that are more different again. Even in the worst case scenario, this vaccine could be resigned and tweaked to be a better match. In a matter of weeks or months, if necessary, say experts. As with flu vaccine, where a new shot is given each year to account for any change in circulation flu virus. Something similar called heaven for coronavirus. Are the modifiers? There is currently no evidence to suggest that any of them cause more serious illness. Measures such as washing your hands, keeping your distance from other people, and wearing a face covering will still help prevent infection. And because the new variants spread more easily, it is important to be extra vigilant. What is being done about it? More variants will emerge. Scientists around the world are on the lookout, and any new variants will be closely studied and monitored. Researchers at the Kenya Medical Research Institute say they are analyzing a new variant that is different to the UK and South African strains. For example, the UK vaccine development Mr. Nadim Zahawi say measures have already been put in place to produce another wave of vaccine if needed.